It was a typical day in the world of tech billionaire Elon Musk, known for his innovative ventures and radical ideas that have redefined multiple industries. But this time, the man who revolutionized space travel, electric cars, and even the concept of artificial intelligence, was on a new mission. Musk, the founder of Tesla and SpaceX, was about to turn the world of medicine upside down, yet no one saw it coming. On a quiet Tuesday morning, Musk made a seemingly casual statement that would quickly snowball into a wave of questions. During an interview at an industry event, he was asked about his thoughts on the future of healthcare. What started as a simple question about his personal health habits took an unexpected turn. Musk leaned in, almost as if sharing a secret, and dropped a truth bomb that no one expected: "We've been lied to for years about medicine. The truth is, much of what we believe is a mix of misinformation and outdated science." The statement caused an instant stir. The crowd was taken aback. What was he talking about? A man who was known for being deeply involved in technology, engineering, and space exploration, now claiming that medicine, one of the most critical areas of human life, was based on lies. Was he really challenging decades of medical research and practice? For a moment, even his own colleagues exchanged confused glances. Musk's words were cryptic, but they held a deeper meaning. He didn't elaborate much during the interview, but the seed had been planted. Social media exploded with reactions, with some calling Musk's comments outrageous and irresponsible, while others wondered if he had truly uncovered something groundbreaking. What did he mean by lies? And what was the hidden truth he was hinting at? The idea that one of the wealthiest and most forward-thinking entrepreneurs in the world could challenge the medical field in such a way was intriguing, to say the least. But Musk wasn't one to make statements without purpose. Every word seemed intentional, carefully calculated to spark curiosity in controversy. And so, as quickly as his comments spread, so did the growing anticipation. Was he about to reveal a massive medical conspiracy? Was there something we've all missed, or worse, something the medical establishment didn't want us to know? Within hours, the buzz around Musk's statement intensified. Journalists began digging into his past interviews, looking for any clues or hints about what he might have been referring to. Musk, always the unpredictable figure, had once said he was constantly learning and never satisfied with what the world knows, which made his claim even more puzzling. What if he had discovered something that others had missed? Was he hinting at a breakthrough that could change everything we knew about medicine and health? But then came the silence. After that statement, Musk said very little on the matter. His social media posts were cryptic, offering no further explanation or context. This only added to the tension. Fans, critics, and even his fiercest supporters were all left wondering what he meant by this bold assertion. Could it be another one of his unpredictable stunts, or was there something deeper lurking behind his words? In the following days, the silence continued, and the world waited with bated breath. Musk, the man who had made his fortune by disrupting industries, had just made a claim that could potentially challenge one of the most established fields of human knowledge, medicine. And no one knew what he would reveal next. Would this hidden truth about medicine change everything we thought we knew about our health? Or was it all just a game to Musk, a way to push the boundaries of conventional thinking once again? As the mystery unraveled, one thing became clear: the world was about to get a glimpse into a world of medicine that had been hidden for far too long. Days passed, and the speculation surrounding Musk's statement grew louder. Fans, experts, and even critics were all trying to decode what he meant by his cryptic words. Some believed it was another one of his famous disruptions, an attempt to challenge traditional systems with his characteristic style of questioning everything. Others thought it might be a publicity stunt designed to spark controversy and increase interest in his various companies. But Musk, as always, remained silent, giving nothing away. Then, out of the blue, a post appeared on Musk's Twitter account. It was simple, but the impact was immediate. It read, "The pharmaceutical industry is stuck in the past. The system is broken. There's a better way, and we're just starting to figure it out." The post was brief, but it sent shockwaves through the media and medical communities. Musk wasn't just questioning medicine in general, he was calling out the pharmaceutical industry specifically. For years, the pharmaceutical companies had been seen as the gatekeepers of medicine, controlling the development, pricing, and distribution of life-saving drugs. Was Musk implying that these companies had been misleading the public for decades? Or was there something more insidious at play? His words were clear enough to make an impact, but vague enough to leave everyone guessing. The speculation intensified, with countless theories emerging. Some suggested that Musk had uncovered hidden research about alternative medicine or a secret breakthrough that could render pharmaceutical treatments obsolete. Others pointed to his own ventures in biotechnology, wondering if he had discovered something within his own companies that would shake the foundations of modern medicine. Was there a hidden truth that had been kept under wraps by powerful industry players? But as the days wore on, Musk's silence only deepened. His post had generated a whirlwind of activity, but he wasn't offering any further clues. The only hint came from a single comment he made in an interview a few days later. Medicine has been held back by bureaucracy, money, and a system that doesn't want things to change, Musk said, his voice calm but tinged with frustration. Innovation has always been about breaking the old systems and creating something new. And the medical world is no exception. This time, Musk's words felt like a direct challenge to the very core of the medical establishment. He wasn't just talking about medicine in general, he was taking aim at the power structures that had kept it stagnant for so long. It wasn't just about finding a cure for diseases, this was about revolutionizing how we approached health and wellness at a fundamental level. Musk was, in his usual way, shaking things up, forcing people to reconsider everything they thought they knew about the medical system. But what exactly did he mean by a better way? What was this new, revolutionary approach that he was alluding to? And more importantly, how would it affect the billions of people around the world who relied on modern medicine? Musk was never one to shy away from big ideas, and this felt like one of his most significant yet. He had already proven time and again that he could tackle complex industries with innovative solutions. But the question remained, could he really take on the world of medicine? In the weeks that followed, rumors began to circulate that Musk was preparing to reveal a new project, one that would change the face of healthcare as we knew it. The rumors suggested that he had gathered a team of scientists, doctors, and engineers to work on a top-secret initiative. There were whispers about a new drug, a new method of treatment, or even a new approach to preventative care that would bypass traditional medical practices entirely. But still, nothing was confirmed. Musk continued to tease his followers with small glimpses of what was to come, dropping cryptic hints about how things would never be the same again. The tension was palpable, and everyone, from health professionals to the average person on the street, wondered, what was he going to reveal next? The medical world was on edge, waiting for the bombshell that Musk had promised, because, whatever it was going to be big. And then, without warning, Musk announced that he would be giving a live presentation in just a few days. This wasn't just any presentation, it would be his most anticipated reveal yet. He was going to talk about the future of medicine, the hidden truths he had uncovered, and how his companies were going to lead the way in revolutionizing healthcare. The world held its breath. What would Elon Musk, the man who had already taken humanity to space, brought electric cars into the mainstream, and built an empire from the ground up, reveal about medicine? Was he about to change everything we knew about health? Or was this just another of his wild ideas that would turn out to be just that? Ideas, but not reality. The stage was set, and the eyes of the world were focused on Musk. No one knew what was coming next, but one thing was for sure, it was going to be a moment that would change everything. The day of the live presentation arrived, and anticipation was at an all-time high. Every news outlet, every health professional, and countless social media users had been counting down to this moment. The topic was simple, yet the implications were profound: the future of medicine, the hidden truth revealed. As the clock ticked down, the world seemed to pause, all eyes turned towards Elon Musk. The presentation began with Musk walking on stage in his signature black jacket and jeans, his usual confident smile replaced by a look of deep focus. As he stood before a packed auditorium of eager journalists, medical professionals, and tech enthusiasts, the tension in the air was almost tangible. Musk opened the floor with a statement that hit like a thunderclap. For years, we've been conditioned to believe that medicine, as it exists today, is the pinnacle of human advancement. But the truth is, we've been stuck in a loop. The systems we rely on for our health are outdated and, in some cases, dangerous, Musk declared, his voice steady but filled with conviction. The audience gasped. It was one thing for Musk to make cryptic remarks on social media, but now, he was declaring war on the very foundations of the medical world. What did he mean? How could medicine, something so universally accepted and trusted, be dangerous? Musk paused, allowing his words to sink in before continuing. Doctors, hospitals, pharmaceutical companies, they all work within a system that's built on old methods, processes, and technologies that haven't been innovated in decades. Worse, they're built to profit, not to heal. The system we trust has become a business, and in that business, the consumer, the patient, has become a commodity. The audience was stunned. Musk had gone further than anyone expected. His critique wasn't just about ineffective treatments or the slow pace of progress. He was attacking the very structure of the healthcare industry, calling out the profit-driven motives behind modern medicine. But just as the crowd began to murmur, Musk revealed the unexpected twist: the solution isn't new treatments or better technology. It's something far simpler, something we've forgotten. It's called prevention. A world where we focus on preventing disease rather than simply treating it once it occurs. This revelation seemed almost anticlimactic after his sharp critique. Prevention. Wasn't that the foundation of modern health advice? But Musk wasn't just talking about eating better and exercising more, he was talking about a radical new approach to health, one that involved using artificial intelligence and advanced biotechnology to predict and prevent disease long before symptoms even appear. He continued, imagine a world where we can predict the onset of diseases like cancer, diabetes, and even Alzheimer's, years before they manifest. Imagine if we could repair the human body at the cellular level, reversing damage before it becomes irreversible. And imagine if this technology was available to everyone, not just the rich, but everyone, equally. The room was dead silent. The idea of preventative medicine wasn't new, but Musk's vision took it to a whole new level. He wasn't just suggesting improved diagnostics, he was talking about creating personalized health systems that could prevent diseases using AI and biotechnology. His idea was radical, and, for many, it felt almost impossible. Musk went on to explain that his companies, particularly Neuralink and Tesla, had been working on the development of a revolutionary biotech platform. This platform, powered by artificial intelligence, would be able to collect data from various sources, genetic information, lifestyle habits, environmental factors, and use it to predict potential health risks. With this system, individuals would receive personalized health plans, including preventive treatments, lifestyle adjustments, and early warnings about diseases they might be predisposed to. As we make advances in AI and biotechnology, we now have the tools to prevent diseases long before they start, Musk said. The current system is based on treating symptoms, but if we shift our focus to understanding the root causes of disease and intervene early, we can stop millions of people from suffering and dying prematurely. The crowd remained motionless, hanging on every word. This was something entirely different from anything they had heard before. Musk wasn't just suggesting a new health trend, he was proposing an entirely new paradigm of care, one where technology, prevention, and personalized medicine combined to create a future where disease wasn't an inevitable part of life, but a preventable one. But here's the catch, Musk added, his tone serious. This technology is being suppressed. The companies and institutions that profit from the current system don't want change. If they lose their grip on the treatment-based model, they lose control. So we need to fight back. We need to demand that these technologies be made available to everyone. It was a direct challenge to the status quo, a call to action for the public to take control of their own health. Musk was pushing for a grassroots revolution in the way society approached medicine. But the deeper question remained, would the world accept this radical vision of healthcare? And would the existing systems, so deeply entrenched in profit-driven motives, allow it to flourish? As the presentation came to a close, Musk's final words echoed in the minds of everyone present. This isn't just about new technology or treatments. This is about revolutionizing the way we think about health. The future is already here, and it's time to embrace it. The audience erupted into applause, but behind the claps and cheers, the questions remained. Could Musk really disrupt the global healthcare system? Was this truly the future of medicine, or was it just another dream from the tech billionaire with a history of audacious ideas? The world would soon find out. The aftermath of Musk's presentation was nothing short of explosive. News outlets across the globe were quick to pick up the story, each one analyzing and reinterpreting his words through their own lens. But the focus was clear: Elon Musk had exposed a hidden truth about medicine, and it was shaking the very foundations of healthcare. As the days passed, the medical community responded. Leading health experts, doctors, and researchers began to weigh in. Some were skeptical, dismissing Musk's ideas as overly ambitious and impractical. AI and biotechnology can't replace years of medical research and expertise, said Dr. Rachel Thompson, a prominent cardiologist. While innovation is important, this idea of using AI to predict disease before it happens is far too simplistic. Yet, others saw the potential in Musk's ideas. What Musk is proposing is revolutionary, said Dr. Henry Klein, an expert in personalized medicine. If we can leverage AI to identify risks and intervene early, we could save millions of lives. But the real question is whether we have the infrastructure to make this a reality. Despite the mixed reactions, one thing was undeniable: Musk had opened a door that no one in the medical community had dared to open before. His call for a shift from treatment to prevention, using technology and AI to predict and prevent diseases, was a game-changer. But the question was, could it work? Was there truly a hidden truth about medicine, one that the world had been overlooking for so long? As the debate raged on, another surprising twist unfolded. A leaked email from one of Musk's top executives revealed that Tesla and Neuralink had already partnered with a number of prestigious medical institutions to begin testing this AI-driven health system. The email, which was unintentionally sent to the wrong recipient, outlined a series of ongoing trials involving AI algorithms that could detect early signs of conditions like cancer, Alzheimer's, and cardiovascular diseases long before any physical symptoms appeared. The email sent shockwaves through both the medical and tech industries. It seemed that Musk's ideas were no longer just theoretical, they were already in the testing phase. The leaked document hinted that this platform could be used to monitor people's health in real time, gathering data from wearable devices, genetic tests, and environmental sensors, and feeding it all into a centralized AI system that could identify emerging health risks. The email also mentioned a potential global rollout of the platform, with plans to offer it to the public within the next 2 years. If true, this could completely reshape how we approach healthcare. Musk's vision of a world where diseases could be predicted and prevented before they even started was becoming a reality, and it was happening faster than anyone had imagined. However, the implications of such a system were not without controversy. For one, there were concerns about privacy and data security. With so much personal health information being collected and analyzed by AI, how could individuals trust that their data would be kept safe? And who would have access to this information? Would healthcare companies, insurance providers, or even governments be able to exploit this data for profit or control? Furthermore, questions arose about the ethical implications of AI-driven health predictions. What if the AI system wrongly identified someone as being at risk for a disease? What if it led to unnecessary treatments or caused anxiety and fear among people who were perfectly healthy? Could we trust AI to make such critical decisions about our health? Would it be ethical to make life-changing health decisions based on an algorithm? Musk's silence on these concerns only added to the tension. He had sparked a conversation that had everyone talking, but he hadn't addressed the concerns raised by his critics. The debate was now in full swing, with people on both sides arguing fiercely about whether his vision was the future of medicine, or a dangerous gamble that could go horribly wrong. Then, Musk surprised everyone by announcing that he would be hosting a global forum to discuss the future of healthcare and the role of technology in medicine. The forum would bring together medical professionals, tech innovators, and policy makers from around the world to discuss the challenges and opportunities of Musk's proposed AI-driven healthcare system. This is not just about technology or medicine, Musk said in a brief statement. It's about rethinking how we approach human health. We need to stop treating diseases and start preventing them. It's time for a new era in healthcare, one that puts the power of prevention into the hands of the people. As the forum approached, the questions only grew more intense. Could Musk really change the course of medical history? Was his vision of an AI-powered, preventative healthcare system feasible, or was it just another one of his futuristic dreams? The answers seemed uncertain, but one thing was clear: Musk had opened a door, and now the world was watching to see what would come through it. The forum was set to be a turning point. Would it be the birth of a new age in medicine, one where technology and innovation ruled? Or would it serve as a reminder of the complex nature of healthcare and the inherent challenges in trying to revolutionize such an entrenched system? The world waited for the answers. As Musk prepared to unveil his next big move, the global forum Musk had announced arrived, and with it came a wave of anticipation unlike anything seen before in the world of healthcare. The event, streamed live to millions of viewers worldwide, was set to be a defining moment in the journey to reshape medicine. Experts from every corner of the world. Doctors, tech innovators, AI specialists, and even government officials, gathered in a grand auditorium to discuss the future of health. Elon Musk took the stage once again, his usual calm and charismatic demeanor tempered with a sense of urgency. As he stood before the packed room, his eyes swept over the crowd. This wasn't just another tech conference or business pitch, it was the beginning of a movement. Musk's grand vision of AI-driven, preventive healthcare was no longer a far-off idea. It was now the center of global attention. He opened with a statement that captured the essence of the forum: the truth about medicine is that it's been stuck in a reactive model for too long. We wait until people get sick, then try to fix them. But we have the technology today to change that. We can see the future of healthcare, a future where disease doesn't have to happen. The audience fell silent, hanging on his every word. Musk wasn't just discussing new treatments or gadgets, he was talking about fundamentally changing the way society approached health. He spoke about using AI algorithms, real-time data collection, and personalized health plans to predict, detect, and prevent diseases. As Musk continued, it became clear that his vision wasn't just about technology, it was about empowerment. He argued that people should have control over their own health, not just in terms of treatment, but in terms of prevention. For too long, healthcare has been a system of power, run by the few for the benefit of the few, Musk said, his voice firm. But with technology, we have the opportunity to change that. With AI, we can give people the tools they need to take control of their own health. And we can do it at a fraction of the cost. The audience responded with mixed reactions. Some were inspired by Musk's bold vision, while others, particularly those in the medical field, were skeptical. Dr. Emily Torres, a leading researcher in genetic medicine, raised a question from the floor. Elon, you're talking about revolutionizing healthcare, but how can we ensure that this technology doesn't cause harm? What happens if AI predicts the wrong things? Could it lead to unnecessary treatments or, worse, create a system where people live in constant fear of getting sick? Musk didn't hesitate in his response. The key is precision. We're not just talking about broad, generalized health assessments. We're talking about personalized health predictions based on a person's unique genetic makeup, lifestyle, and environmental factors. The goal is to intervene before diseases manifest. Think of it like having a personal health assistant that works 24/7 to monitor you, detect any early signs, and provide tailored guidance to keep you healthy. The tension in the room was palpable. Musk's idea was groundbreaking, but it also raised a cascade of concerns. Could a system like this be trusted to accurately predict health risks? Could it replace the expertise of doctors? And what about the ethical and privacy issues surrounding such intimate access to personal health data? Musk acknowledged these concerns, but he remained resolute. Yes, there are challenges. But this is the future, and the future is about using technology to improve lives, not just make profits. As the discussions continued, more details about the technology behind Musk's vision began to emerge. Neuralink, Tesla, and a number of secretive biotech companies Musk had been quietly working with had already developed an early version of the AI-powered health system. In the coming months, they plan to launch clinical trials to test the effectiveness of the system in predicting and preventing diseases like cancer, heart disease, and neurodegenerative disorders. But the most shocking revelation came from Dr. Mark Levin, a well-respected AI researcher who had been brought in to help Musk's team develop the technology. What Elon is suggesting isn't science fiction, Dr. Levin stated. It's real. We've been testing AI algorithms that can analyze an individual's health data and predict the likelihood of diseases developing over the next 5 to 10 years. It's still early, but we've already seen promising results. Dr. Levin's words sent a ripple of excitement through the crowd. This was no longer just a concept, it was a revolutionary breakthrough that had the potential to disrupt the entire medical field. If these AI algorithms could be perfected, they could truly change the way we approached health, shifting the focus from disease treatment to prevention. But with that promise came significant risks. As the forum progressed, several key issues were raised. Privacy concerns dominated the conversation, with some participants fearing that widespread data collection would compromise personal health information. Bias in AI was another issue, as algorithms might not always account for the unique challenges faced by certain populations, such as people of color or those with rare conditions. And then, there was the question of who would control this new system. Would it be Musk's companies, or would government step in to regulate it? Despite the skepticism and concerns, Musk remained focused on his message: the current healthcare system is broken. We need to disrupt it. And we need to disrupt it now. As the forum came to a close, it was clear that Musk had ignited a firestorm in the world of healthcare. The debates would continue, but the seed had been planted. The world was now faced with a crucial decision: would they embrace Musk's radical new vision for the future of medicine, or would they continue with the old ways, clinging to a system that had long since outlived its usefulness? One thing was certain: the future of medicine had just become a lot more uncertain, and a lot more exciting. As the dust began to settle after Musk's forum, the world stood at a precipice, unsure whether to leap into the future he had envisioned or to cling to the familiar, but increasingly outdated, systems of healthcare. But as time passed, something unexpected began to unfold. Musk's vision started gaining traction. Several tech giants, who had previously been cautious about diving into the world of healthcare, began publicly expressing interest in Musk's AI-driven health system. Apple, Google, and even smaller biotech startups started announcing partnerships with Musk's companies. In what could only be described as a massive shift in the tech industry, Silicon Valley was suddenly filled with a sense of urgency. These companies were not just seeing Musk's idea as a potential opportunity, they were seeing it as an inevitable transformation. For the first time in history, tech and healthcare industries were collaborating on a scale previously unimagined. Medical institutions and government regulators were scrambling to catch up, trying to figure out how they could integrate Musk's proposed technologies into existing frameworks. But there were hurdles. The pharmaceutical giants, who had profited handsomely from the current treatment-based system, were not so easily swayed. They saw Musk's idea as a threat to their very existence. Behind closed doors, intense lobbying began. Pharmaceutical companies, health insurance providers, and traditional medical institutions launched campaigns aimed at discrediting Musk's claims. They used their power to fund studies questioning the feasibility of using AI for disease prediction and prevention, arguing that it was too risky to trust algorithms with something as important as human health. But Musk, as always, wasn't fazed. The pharmaceutical industry is driven by profits, not cures, he remarked in one of his interviews. They make billions by treating sickness, but they don't care about preventing it. That's why we need to change the entire paradigm. The battle was now officially on. Musk had made powerful enemies in the form of entrenched healthcare giants, but he had also created a movement, one that was gaining support in places where it mattered most, among the public. Across the globe, grassroots movements began to take shape. People were starting to realize that the medical system had failed them, not just in terms of treatment but in terms of access to healthcare. Musk's call for prevention, powered by AI, resonated with millions who had suffered from chronic conditions, who felt that the medical system had merely treated symptoms rather than addressing root causes. By now, more details had emerged about the AI health system Musk was developing. Tesla's involvement in healthcare became more apparent, with the company's existing infrastructure being used to develop new wearable health devices that would collect real-time data on everything from blood pressure to environmental factors that could influence health. These devices, once fully integrated into the system, would feed data into a central AI system that could track users' health over time, flagging potential issues before they became major problems. Meanwhile, Neuralink's advances in brain-machine interfaces were being incorporated into the platform, allowing for more detailed personal health information to be gathered and analyzed. For instance, the system could detect early signs of neurological diseases, such as Alzheimer's or Parkinson's, by analyzing brain activity patterns that were too subtle for traditional diagnostic tools. But as the public became more excited about the potential of Musk's health revolution, concerns continued to rise. Privacy remained the top issue. Critics feared that the widespread collection of personal health data could be exploited, leading to breaches of privacy or discrimination in the workplace or by insurance companies. Despite Musk's assurances that the data would be kept secure and used only for the benefit of the individual, trust in the system was slow to build. Then came the breakthrough moment. Musk announced a global partnership with the World Health Organization, WHO, to launch a massive, real-world pilot project that would test the AI health system in underdeveloped regions. The pilot, which Musk dubbed the Global Health Initiative, aimed to provide preventative healthcare services to millions of people in regions where access to medical professionals was limited. The idea was simple: use AI to predict and prevent diseases before they became widespread. By integrating wearable devices, genetic data, and lifestyle information, the system would create highly accurate health profiles for individuals, giving them personalized health plans and the tools to manage their well-being proactively. It was a monumental step. If successful, it would not only prove the efficacy of Musk's vision, but it could also transform healthcare in some of the most vulnerable regions of the world. And it could provide the validation Musk needed to cement his system as a legitimate alternative to traditional healthcare models. But the stakes were high. If the pilot failed, if the AI system made a wrong prediction or caused harm, Musk's critics would have all the ammunition they needed to dismantle his vision and discredit the entire movement. As the pilot project rolled out, the world watched with bated breath. Would this be the beginning of a new age of healthcare, where technology and prevention replaced outdated treatments and profits? Or would it be the end of Musk's dream, a lesson in how even the brightest ideas can falter under the weight of reality? The world was about to find out.